questions will start, but I also wanted to thank Steve Angles for going back to the dark side, or trying to, and did an admirable job. And
luckily, they have showers in our rooms.
You don't have the judge in your corner, but you did well with the heat. Melissa, thank you very much. Excellent presentation. Wow.
Though, I got to apologize to the audience. I totally got freaked out when she asked how many patients. In my clinic, my 4 practitioners, my 2 physiatrists, I personally see 35 patients a day in clinic and do 2 days of clinic a week. So just to clarify. But I totally freaked out on that. And then the whole time she's asking me questions, I'm thinking about, God, why did you say that? In front of Dr. Bones.
And your blood pressure.
Yeah. Woo! Yes, sir.
But that happens.
Scott, could you grab that microphone over to...
The reality is, even though you guys are role-playing this thing and it was just amazing, that happens. I mean, this happened to me 3 weeks ago, where in a deposition I was asked by, in this exact scenario, the attorney for the insurance company, and they said something like, "Are you aware of the prior treatments before the patient came to see you?" And I said, "Yes." "What were they?" The patient told me they went to physical therapy, urgent care, etc. "Were you aware they went for chiropractic care?" "Yes." "How did you know?" "The documents that were given to me by the attorney for the patient." "Well, do you not find that strange that the attorney was the one who provided you without documents?" "Well, no." But then, just like you, I was like, oh my God, did I just blow the whole thing, because it divulged that I didn't know or didn't have the chiropractic notes. And so that's real. I mean, that crap happens. You all of a sudden get that very unsettling feeling in your stomach. I just screwed up the whole dang thing for Mr. Smith. So anyway, that was great.
I have a tip for that. So if it's a deposition, after you answer the next question, you say, "I need to take a break."
Yeah.
They don't know why you're taking a break. And you go down the hall, and hopefully the patient's attorney is picking up on your body language that you need a minute with them, and they can come in and say, "All right, no big deal." It's really just a legal trick. It's really not a big deal at all who gives you the records at all. So.
But the drama of the situation can create this, like, oh my God, I'm going to trial now. Oh no, I didn't want to do that.
You see it on your face too. It was like, all of a sudden it was like the wheels are
But you could always take a break. You could always come back on the record and say, "I want to make sure we're clear about something when you asked me about this." And it's really common in clinical practice for me to get information from the patient, the patient's spouse, the family doctor. People bring me records. It's no big deal. Yeah. So you got a way to clean it up. And whenever the question Steve was going there, like, did you meet with the patient's attorney in preparing for it? One thing that I didn't do with the doctor was to say, you're probably going to be asked one of these questions about, did you meet with the attorney? And I always say, this is a really fun time to really have some fun, because then, did you meet with the patient's attorney? Yeah, you mean Mr. Adler? Yeah, I did meet with him before. And did he go over what you were going to testify to? Well, we just went over, information. What did he advise you? Oh, he gave me some really good advice. And the attorney on this side salivating, like, oh, yeah, I'm going to hear some good stuff now. What did he tell you? He told me to tell the truth. Oh, okay.
Yeah, it was something we could have gone further into. As a teaching tool, I wanted to throw it out as sort of like, this comes up, but yeah, what did you talk about? Oh, we talked about wizards and Harry Potter, Same thing with the question on when I asked Dr. Minista if he's being compensated for his time. Whole little line of questioning that we can't do in 20 minutes about, well, what is that amount? Has it changed? Can you produce records to support that? All of that is, again, another path that you could go down if there was time. So
the preparation for the deposition wouldn't be 20 minutes. I probably would book an hour of time, because I know it's mission critical.
I understand the insurance company wants to limit their liability, and I think the key words in this chiropractic statement in here hasn't been mentioned, and that's he indicated, that he gave him, as long as he received maintenance care once a month. So that right there tells me he's got chronic ongoing problems. I would like to know, if he didn't have chiropractic care, what would happen to him? So that to me would show pre-existing injury. So I think the liability for the herniation is there, but maybe not totally, this is where we're going to get into the proportionality.
It could come to proportionality.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.